is Jennifer Price, and I am SMA's Director of Education. Today, Dr. Christopher Morris, SMA Executive Director Randy Glick, and I are talking about SMA, scholarly activities for physicians in training, and game shows. Dr. Christopher Morris is a rheumatologist in private practice in Kingsport, Tennessee, and has been a longtime fixture at the Southern Medical Association. He has been involved with SMA since he was a resident and served as SMA's president in 2020 through 2021. Most recently, Dr. Morris was the host of SMA's inaugural Smart Bowl, a medical trivia competition similar to the game show Jeopardy, during which several teams of medical students, residents, and fellows from programs across the country competed for cash prizes. And given his past brush with game show fame, Dr. Morris was the perfect choice to emcee the event. During his 3-year internal medicine residency, he had the distinction of being the first internal medicine resident who was allowed to travel to Los Angeles to be a contestant on Jeopardy! Only a strep infection on the day of the taping prevented him from running the table on his opponents. So with that, Randy, would you like to get us started?
Would definitely be remiss if I did not have you share your Jeopardy story. I know I've heard it before, but I think that it's worth repeating. So share your Jeopardy story first off with us, your personal Jeopardy story.
Well, I was doing I was in a 1-year training program out in Long Beach, California. And it was only the second or third season that Jeopardy was back. I grew up as a child watching Art Fleming and Don Pardo whenever I was home during the daytime and saw the original Jeopardy. And when we'd see the evening version of Jeopardy with Alex Trebek, they always had a phone number, and I wrote it down. And on a lark, before I left LA, I figured I was so close to Hollywood, about a 45-minute drive, I ought to see if I could try out. So I called them, made my appointment, and took a day off of training, and signed up to take the Jeopardy test. They gave it during they gave it in the studio. And they'd hand out some boards, and they'd give us a test. They gave us 13 minutes to answer 50 questions. Just write down the answer. They didn't want it in the form of a question or anything like that.
Yeah.
And there were about 50 people in there. And while they were grading the test, they went out of the room and they graded the test. And one of the things I did, they put on one of the shows from the previous year, and all these people are screaming out answers. I'm like, oh my God, am I really supposed to be here? Well, then came the contestant coordinators came in, and they started reading off names, and I was one of 9 that was asked to stay on. The others said, thank you very much. You can try again in 3 months, because that's when we change our test. So they tell them you can't take it more than once every 90 days. They had us do a practice test where they gave us a little bell to go ding, and they told us we had to ring it on the last syllable of the last word in any question, because they were trying to see how we would do with the timing, if we were early or late.
Yeah.
And they had 3 practice games, and they'd hold up a card with the thing. And so then they said, okay, thank you. And they walked out of the room, and then they came back and said, the following 5 people are asked to stay on. The rest of you, thank you very much. Try again some other time. And so I had to give a little thing about who I was and everything else. And as I was leaving, I remember very cryptically, Glenn, the guy, says, well, we'll see you again, Chris. And I was like, oh my gosh, maybe I made it. As I was driving, pulling a U-Haul trailer across Arizona, I literally had left a message. This was pre-cell phone day, so I had to leave a number, and I left my dad's office. And I called to let them know that I was on my way. And my dad's secretary, the word she says was, hey, Chris, Jeopardy called. And so I was stunned. I was all excited, and I checked on it, and I said they wanted me in about the 3rd week of July, 2 weeks after I'd started my residency. And so one of the first things I had to do when I started my residency at UT was go into the chief of rheumatology, ask for 2 days off so that I could go fly to LA to be on Jeopardy! He thought about it. He says, well, you only can be on it, and you can only say where you're from if you win.
Yeah, exactly.
And so I flew out, and I stayed with some friends in Long Beach. I had rented a car, and the night before they were recording, I came down with a strep throat infection. So I was running a fever the whole day, sore throat, felt like crud. But I stayed on. I was going to do that come hell or high water, because that was the one chance in my life and they only take 300, 400, 500 people a year. So out of, the 300
Yeah.
million Americans, you're only going to get maybe 400 people have a chance to be on Jeopardy in a given year. So that's a little bit of a exciting thing to do.
Yeah. I know that.
It was a phenomenal experience. I had some antibiotics, so I was starting it, and my fever started to break just as I heard the words, "This is Jeopardy." But back then the prizes were, they gave some door prizes, which they give you a little list of commercial things.
Hmm.
My prize, though, before they gave cash, was a reclining Queen Anne chair.
Ooh.
I got to choose the upholstery, and it's literally about 15 feet from me right now in my living room. So I still have it. It still works. The fun thing is that, I did well enough. It was a close enough game where if any one person had gotten Final Jeopardy with the other ones not, they would have won. Interestingly enough, all three of us got the Final Jeopardy correct. And so that I still feel pretty proud that I did it. It is something I haven't
Absolutely.
really been that boastful about being on it. I have to admit, I sort of kept it sort of quiet. But anyway, I still watch Jeopardy. My father and I, what we would do is we would call and chat during Final Jeopardy and try and guess the Final Jeopardy category answer just on the basis of the category.
Oh.
And we actually did pretty well. About couple times a month, we would actually get the right one. The day my son was born, the Final Jeopardy category was Renaissance artists, and I predicted Michelangelo. And the thing was, I was in my wife's hospital room, and she was asleep, and the nurse was watching me do this and going through all the answers. She's like, "God, you know everything. Have you seen this one before?" I went, "No."
Yeah.
Finally, it comes up, Final Jeopardy category, and it comes up, and I said, "It's going to be Michelangelo." She says, "How do you know?" I said, "I just know." And it was Michelangelo. And boy, you should have heard comments she made at the nursing station. She was like stunned. How in the world did he do it? I had a little bit of mystique about me just because of that.
That's
But
fun.
to this day, I'm a big trivia buff. I regularly go on a website called Fun Trivia, which has a lot of good trivia games and so forth. And I actually am on a team of trivia players through that one that includes people from England, Poland, Sweden, and here in the US, which is sort of neat because you get to, we sort of have messages to each other and little conversations as part of the team. It's really sort of fun to think you've got a trivia buddy in Leeds, England.
Well, that's perfect. And I appreciate you telling that story, because when I heard it for the first time, it's interesting and it's fun. And it was so perfect that last year for our first inaugural, that we had you to do this. It was so much fun. And it was interesting to me that, because I think it was 4 hours, but people stayed, they watched, they were glued. It was funny. Just the whole thing. It was such a success. So we're looking forward to doing it again next year, and you hosting it next year. But what do you think made it a success? What do you think about last year's Smart Bowl that you think made it a success and so much fun? What do you think the key was?
Well, one of the things I wanted to do, I didn't want to make it just a regurgitation of medical knowledge. I think one of the biggest things is we in medicine right now, and everybody in education for that matter, seems to be teaching to test. And these people can remember this little piece of medical knowledge and this and that and everything else. There's more to being a physician than being able to recite which bone is the biggest between the stapes, malleus, and incus. I think, there are things, we want people, we're people, we are not computers. Right now, they're talking about AI being able to replace doctors. Baloney. We have to be able to think of people as people. We treat patients. We don't treat just a symptom. We treat a patient. And I think that you have to be knowledgeable in other things outside of just purely the science and the chemistry and things like that. I think that, there's a lot of, obscure knowledge about healthcare. And For instance, knowing some of the medical history. Who the heck was Crawford Long? This is where medical history is made in the South. And so this is why I think it was important that we had more than just a little, medical knowledge. We also had to have medical history knowledge. We had to know some obscure things. For instance, I always love to tell the story of the Russian doctor who was in Antarctica and had to perform an appendectomy. Well, the thing was, the only person there that could do the appendectomy was him, and he did it on himself. That is something that I think is something to think about. These are little tidbits, and I think those make it a little bit more interesting. Knowing, for instance, what is coulrobophobia, which happens to be fear of clowns. I mean, these are things that are sort of fun. You have to, it is not going to change the dynamics of a patient, but it's having that in the back of your head. At some point, it may come out where you need to, where it helps you sort of meet up with your patient, shows that you're a human too.
Connect. Yeah, no, I think connecting.
Connections.
Yeah. And I think that it also is why you go to a medical meeting, to your point too, because I would tie in not just going to a medical meeting to accumulate CMEs and to check out, get up to date on the latest guidelines or whatever, but to have fun. It was so much fun. And some of the questions were like that one it helps people connect. It's people are blowing off steam a little bit. They're having some fun. So I think all that ties together.
Mm-hmm. And I think the competitive part of it, some of them were, they were diehard competitive people. And I was like, oh my gosh, it was a little intimidating. I think though, I've been around some people who try to demonstrate their knowledge. I think, there are people, I tell patients every now and then, I talk about stuff that I do. And I tell them that the difference between me and such a doctor is the only time I walk on water is when it's frozen. And I think it's true. I laugh with my patients. Yesterday I had a patient who just came over as we were going toward the lab. She just came over, thanks, and gave me a hug. I mean, that's not something you're not going to see somebody hug a computer. They're going to, they want someone who's a person, not a generator of medical stuff, because there's more to them than their disease.
Yeah, no, and look, this is sort of the theme that we have flowing through this whole year, which is, the importance of the physician-patient relationship. I mean, there's some data out there. I think I'd like to see more, but patient adherence, how good is patient adherence to treatment when they actually like their doctor and can connect and relate to them? Dr. Carter, the president this year, has a small concierge practice in Hickory, North Carolina. He actually has relationships with his patients. He knows what's going on with them. It's all part of that, the ability to relate to your patients and how much better the outcomes are going to be for your patient if you can connect with them. So all this runs through everything we're doing. So I agree.
It's funny that you say that, because someone said to me this morning, a physician said, patients don't care what you know until they know that you care.
Yeah.
And it was just a really interesting kind of bringing together what you just said, Randy. So it's interesting that I heard that just this morning, and we're having that conversation.
So Smart Bowl is about letting off some steam, having some fun, learning some useful and some useless trivia to just help residents going into practice, maybe understand that there's more to it than just memorizing the books and the facts and things. So
yeah, there's a lot of stuff I had in those questions that are not in Harrison's textbook of medicine. Yeah. That's the truth. I think, and there are times when you have to think, and I think, being able to regurgitate stuff out of a medical textbook's fine and dandy, but there are times when you have to think. One question I loved asking was that, a human has 7 cervical vertebrae. How many cervical vertebrae does a giraffe have? And the thing is, it's the same number, 7. It's just theirs are really big. And so, and it's just, those are the little things that, they make you think. And, it isn't in the textbook, but you need to do some deductive reasoning. And that's where the good doctors are. As a rheumatologist, we deal with strange and unusual diseases. The joke I've had is that rheumatologists deal with odds and ends, because if it's odd, it ends up in my practice. And so we see the things that nobody else can figure out what's going on. So they say, well, it must be rheumatologic. And that's why they end up here. Yeah. And it's that you have to be a good diagnostician, you have to put a lot of little things together sometimes to come up with the answer. I have residents with me all the time. And the thing I want to impress on them is that by, the best diagnostic tools that physicians have are these, and these. And if they don't learn how to use those things, they're going to be at a disadvantage, and their patients are going to be at a disadvantage. Yeah. I think I'm a strong believer, and so I get when the residents do rotation with me, they actually palpate joints. They feel what a joint feels like. They do feet and hands and everything else, and we get some subtle things, subtle findings. I point out, do you see this? And then you see that, and they're like, oh my gosh. I had a resident the other day, and one thing, I wanted to let you all know this, a resident the other day, I was talking to them about some of the podcasts I've done for SMA, and I brought up the idea of the diabetic musculoskeletal manifestations. She had never heard of it. She actually that night signed on and watched. She says, I can't believe all those things. I've never even noticed them. Made me feel sort of good. And so I think these are things where we look at things, and you have to come up with some strange and unusual things, which is why rheumatologists are a little strange and unusual in the first place, but that's neither here nor there. But I think the more we do, and the more we realize that we have to be treating a person, not a syndrome, not a disease, not a problem. You have to treat the person as a whole. And that's where you sometimes have to have a little bit of knowledge outside of what is sent in the medical textbook.
Yeah. Abstract thinking, creative thinking, creative troubleshooting, and relatability. So these are all things that not only just the SMART Bowl, but what we want the assembly to always be is connection, having fun, connecting, diversity of the people you meet. That's why it's, I hear over and over again from our leadership that, having so many different types of physicians at a meeting at the same time, just you learn so much just from the relationships with people that are doing things, in some cases vastly different from what another's doing. Practicing physician for someone in academia, a primary care physician, and a specialist of any different kind. What do you have in store for this year's SMART Bowl? Anything, any twists or turns, any kind of different approach to what we'll do this year?
Well, one thing I want to do is I want to enlist some help of, I'm going to ask a number of people out there, especially on board members and committee members, if they may be able to do a little help with putting together questions. Last year, I put together over 180 questions for the competition, which was racking my otherwise feeble brain at the end of the thing. The one thing I have learned is that rather than just try and come up with a trivia question, I'd rather coming up with a trivia category, such as, say, phobias that start with the letter C, things like that, or it's endocrine to me, things like that. And then where they come up with a category, because then you could come up with 5 different questions for that category. Yeah. Rather than starting with a question and then saying, okay, what category can we put in this, and then go backwards. Makes more sense if you can come up with a category. The thing is, I am right now, compiling a few dozen categories. Some of them may be the same categories as we had last year, but they can always come up with new questions on these categories. And getting any of the people that are ENT to maybe come up with some, questions related to ENT diseases. People that are, say, pathologists, or, sometimes they'll have some fun ones. We want them to be challenging. We don't want them to be so impossible that they all sit there and say, God, I feel like an idiot because I didn't know that one. We want to be able to fun, but we want to also be a little entertaining. We also want them to be a little interesting.
Yeah.
And that's something we can do. One category I had last year was I thought was sort of fun was, where is this hospital? And so it was hospitals in the Southeast that people might know. We had Grant, we had, in Miami, we had, Crawford Long Hospital is named for the guy who first did general anesthesia. And that's, which is actually, it was because of Crawford Long's actions that Doctor's Day became something. And because we realized we were honoring Crawford Long and his day, and that's how Doctor's Day came about. And so that, all of these, Doctor's Day didn't just magically appear.
Yeah.
It actually, there was a basis behind why it was chosen for that day. And this is things that are important. I mean, we all get our little doily bag from the hospital who's, gone and bought them on, consignment and the cheapest one they can get, but that makes them feel like they've done something for the doctor. Doctor's Day is coming up in a week or so. And so I think, that's why we honor that day, because of guys like Crawford Long, who were some of the first people. And so I think, doing a famous firsts, those are fun things. And it's, that way we also remember who our, where our heritage is in medicine. Because if we don't learn from the past, we are doomed to relive it and make the same mistakes over and over and over again.
Yeah.
And so this year, what I'm going to do is I'd like to get some help. We're going to ask people, I'm going to make a list of a bunch of categories and send them out, and ask people to spend 15 minutes. One thing I will remind them is, if they have to, they should turn on an episode of Jeopardy and see how short the questions are and how short the answers are. We don't want a 56-year-old male with a history of this and this, this and this, and then following this and this, and smoke 6 packs a day. We want him to be, right. Like, who is Bowman Gray? Because, Bowman Gray School of Medicine, and, in Wake Forest, that was the original name. Who was Bowman Gray? You know who
Dr.
it was?
Carter should know that. I believe that is where he went to school. So
that's
maybe
true. And, well, believe it or not, but it's sort of been subtly changed because of the fact Bowman Gray was the president of R.J. Reynolds Tobacco Company. And so they don't really want to, I think they were sort of like, I don't want that. In rheumatology, we've had several diseases that the name has changed, largely because the eponyms were for people that we ended up becoming Nazi war criminals because of the research they did in concentration camps.
Hey, gosh.
And so anyway, that's why I'm saying these are things will be fun. But the thing is that if we can come up with some other, people to enlist it, we may not use, I would love it nothing better that if we had so darn many questions sent in that we may not be able to use them all this year, but can use them next year and the year after.
Absolutely.
And it wouldn't hurt to have a couple of single questions too, so we can have a final category for the final round. And so those are things too that would be fun.
Yeah, we took that approach when we first started this. We got a internal medicine, can't remember what publication it was, but basically it had a bunch of questions, and that was it. The questions were, you wouldn't be able to get all the questions in. You'd have enough time to have a game because the questions were so long. So I think it was a very rapid pace. Last year, it was, some of the technology we're going to do differently. We had those push buttons last year, and we had a couple of those plungers go bad. And to your point, they were frustrated about those plungers. Very competitive. But we do have the ability to use smartphones this year to buzz in. So we'll probably change things up a little bit with some of the technology, and I think going after a broader bank of questions from our membership and our leadership is a great way to go.
Yep. One thing somebody asked me, God, aren't you tired? And I said, no, the adrenaline was just started flowing with the questions. And I mean, I was I mean, it took me about half an hour to collapse at the end of the thing because of the, I mean, you started going and it was just like you could just feel the adrenaline pumping to keep me up on it. And so, I gave total respect I had developed a whole lot of respect for Alex Trebek, because Alex used to tape 5 shows each day. So when when they do the recording, they're recording 5 shows. And the thing was, one of the things he did, which was sort of interesting, is he stayed away from the contestants, because one thing is before he does it, he goes through all the questions in his dressing room. And so he's gone through them a couple of times, and to make sure there's certain words he knows how to pronounce and everything else. And he's afraid if he says, "How are you?" or whatever, they say, oh, well, that's where, and he'll give away one of the questions. And so they really try hard. He tried hard to avoid, until, like we had a lunch on the sound stage. They put up a catered lunch one for all of us who were sitting there for the 5 rounds. That was right on the sound stage of Soul Train, because I could see the ball, the light ball, the glass ball on the ceiling above us. So it was sort of fun. You could tell where we were. But I mean, little things like that are just, made it a lot of fun. But, you got to give them a lot of, because the adrenaline gets going, and it really was a lot of fun doing it.
We need a mirror ball this year.
I've got some. I have the big ones all the way to the little ones. Is that a task for me to bring?
Yes. We're gonna add a mirror ball for sure. That'll make it fun. Go ahead, Jennifer.
Oh, I just wanted to ask, kind of shift. You touched on this, Dr. Morse, just really quickly. You've been a part of SMA since you were a resident, and you've presented papers. You have been a part of this new competition that we're doing. And while these are meant, to be fun, and to your point, collegiality, connecting, they're also kind of they're meant to be a learning opportunity as well. And I guess if you could just kind of touch on the importance of these as scholarly activities to these young physicians as they're starting off in their paths of presenting papers and learning, like you said earlier, knowledge that you're not necessarily going to get in a textbook or in the lecture hall. Could you touch on that for just a minute?
Okay. Well, I'm a rheumatologist, and I'll be honest with you. I'm not going to get a lot of rheumatologic knowledge from the SMA meeting, because of the fact the stuff I deal with is so obscure and so limited and so focused. I'm going to get that from my national organization. But the thing is, if I go to my national organization meeting, I'm going to get minimal updates on, say, the new treatments for diabetes, which every one of my patients it affects. Let's face it, right now, several medicines for diabetes are being used for weight loss. Well, guess what? We get them coming in and they tell us, this is what I'm on now. And we're like, okay, how does that affect my diseases? How does that affect my medications? How does that affect my treatments? And so I think this is where the SMA is important. What it does is it allows us to get together and learn from other specialties so we can do this. One thing I bemoan is one problem with the development of hospitalists is that we have lost a lot of the collegiality. When I was first starting out in practice, my office was 100 yards away or 50 yards away from the entrance to the doctor's lounge. I would walk over for lunch, and we would sit around, and I'd be sitting with a pulmonologist, a cardiologist, a plastic surgeon, a GI doctor. And the curbside consult was great, because if I saw an interesting thing, I could ask one of my colleagues, hey, tell me about this little thing. And I could get a mini lecture on it. Yeah. Unfortunately, the hospitalist has meant that many people, the only time many of us specialists ever go in the hospital is to eat lunch and to pick up our mail. And even then, we're not doing that. And so I think that's something that has taken its toll on patient care, in my opinion. We've become so overly focused and specialized that we forget that there are other parts of the body. As a rheumatologist, we are a pretty good generalist first, because of the fact that when my diseases come around, there is no organ system in the body that is not affected by a rheumatologic disease. Cardiologists have the heart. nephrologists have the kidneys and and the thing is, we sometimes forget other parts of the body that go along with those diseases. This is where I think SMA flourishes, because of the fact that we get specialists to share information with other specialists and even the primary care people. The thing, really it's a sad truth that unfortunately most family practitioners do not get rheumatologic training. Nurse practitioners get zero rheumatologic training. And so if they don't get it from their national organization, they're not going to get it.
Yeah.
We interviewed a nurse practitioner candidate to join my office, and we asked her, what was your training in your nurse practitioner school? And she says, well, my teacher, I asked her about what do I do if I see an arthritic condition? And she says, oh, that's easy. Just refer him to the rheumatologist.
Yeah. Yeah.
And since arthritic and back problems are the #1 reason for a patient to go to their doctor's office, that does not do well for the patient.
No, you're just tossing them over the fence. We're teaching to do this and then just shuffle them off. As someone who remembers very vividly having to get my grandmother from her apartment to the car to the hospital, down the hallway, that doesn't work for the patient. So anyways, I'm gonna steal your thunder, but yeah, I think that having the beauty of SMA is the diversity. It's the students, first year, second year, third year, fourth year, residents, fellows, physicians, academics, specialists, primary care doctors, all in one place, having fun together, learning about lots of different things that are taking place, obviously in the classroom, but also what's taking place in the relationships that are being built and the communications that you have, like the lounge consult that used to take place. It's sort of like that, trying to bring that or keep that going.
Well, when I was president 2 years ago, one of the things I wanted to do was get some topics out that would be, #1, helpful to specialists throughout all specialties. And #2 was to do topics that really have not been well done at other meetings. And that is why two of the lecture series I had was on diabetes and some of the new treatments and the new units and everything else, and autism. These are topics that are pertinent to any specialty, because you're going to see people with those diseases and you need to know a little bit more about them. And so that's why I think that I was very pleased that they turned out as well as they did. And, the nice thing is those same lectures are still available through the bank at SMA. And I think that's an important thing. As I said, the musculoskeletal manifestations of diabetes, I don't know if there are many places that have a lecture on that, even though it's one that is extremely common and is really under talked and under discussed by most people. The president was she was like, I've got so much information from it, I'm going to share it with my colleagues. Guess what? That means other people are going to get the information. And it also exposed her to what is available at SMA. And so that's where getting the residents started on this, seeing what's available, seeing what they can learn. And I think that's a great experience. I think the lectures we give are fantastic. I think that getting together with other specialties lets them see that it's okay to talk to someone else that's in another specialty. We need to provide care, not referrals.
Yeah, that sums it up. I don't have any other questions. Jennifer, do you have anything else?
I don't. I just want to say thank you for your time, and we look forward to your being at our annual assembly in October. I think the Smart Ball is going to be another success, in large part to your participation, Dr. Morris. So thank you.
Well, have a good day. We'll talk to you later.